Hi, it's Dr. Amy Salerno, also known as Doctora Latina or Draw Latina. This is part 2 of probably 3, maybe even 4 parts of review of the Kiely Rodni autopsy, as well as some of the pre-autopsy documents that were published. I realized that in trying to sort of distill down what it is that I want to share with you all, it is going to take a little bit more time. And as my mother always says, no souls are saved after 15 minutes. And so I really want to keep my videos down below the 15-minute mark. So let's try to get through part 2 tonight. I'm going to address some of the questions that people asked in the comment section and clarify a little bit about the fentanyl testing that may have been done, although not well documented on the published papers that we were able to receive through FOIA. I think maybe first I'll address the fentanyl issue. And that is as follows. Yes, an expanded toxicology tissue toxicology was ordered by the medical examiner and sent to the lab. While expanded included testing for fentanyl, there was really no statement made precisely by the medical examiner regarding the fentanyl issue. You can make a presumption by calling the lab. Of course, through HIPAA, they would never reveal any specifics of Kiely's or any other patient's findings. However, because communication is so very paramount in medicine as well as medico-legal procedures, having to sort of two-step, extrapolate back, call a lab, that is not streamlined. It's clunky, and it really should not have to be done as part of understanding a toxicology report, especially in light of the fact that this was or is still a criminal investigation. The Truckee, Placer County, Nevada County areas really are almost epicenters in the national epidemic of fentanyl overdosing and the unfortunate lacing of fentanyl and the inadvertent overdosing. So we know that that is an important aspect, especially in this case. Also, folks may or may not be aware of the fact that a young man, approximately 20 years old, was arrested within a week or so of Kiely's having gone missing and charged with murder because he had supplied a fentanyl to a 15-year-old young lady, and she died. So this investigation has many layers, and that is why it is incumbent upon the agencies involved to keep communication open amongst themselves and also to the public, because where there's not good communication or sloppiness in documentation, it only serves to fuel, unfortunately, to fuel conspiracy theories or to promote the sense of lack of confidence by the public vis-a-vis law enforcement authorities, including the coroner and medical examiner. So prior to diving in to the specifics of why I do not think that drowning necessarily could be the reason for Kiely's demise, I think it's very important to remember what I said from the previous part 1, and that is that on autopsy, drowning is a diagnosis of exclusion, meaning that it's quite difficult. Sorry to cough. It is quite difficult to come up with that diagnosis because there is not one, what we call in medicine, pathognomonic finding. There is not one identifying, this is it, eureka moment for drowning. Indeed, it is the diagnosis of accidental drowning is what we call a diagnosis of exclusion, and it is a result of what we say in medicine, a constellation, like stars, a constellation of factors. Not only post-mortem physical findings, and I'm going to go through that probably in part 3, but it is a constellation of macroscopic, what you can see with your eyes on autopsy, microscopic findings, as well as from the moment of finding a deceased body submerged in water, those communications from the various authorities. All of those investigations have to be brought together in order for the medical examiner to make the presumptive diagnosis of accidental drowning or drowning. There are a couple of articles that I'm going to actually link later this evening to this episode in case you want to take a deeper dive into some scholarly articles around drowning in general, around the difference between freshwater drowning and seawater, saltwater drowning, and how decomposition occurs differently in those different types of waters. Also, how the body reacts, how the weight, for instance, of the lungs in a drowning is different from with respect to freshwater or lake drowning and ocean or saltwater drowning. I'm going to go through some specifics and walk folks through that, but I think that's going to have to wait till part 3. Okay. Now, before we dive in, and that'll be in part 3, no pun intended, before we dive in to the autopsy, looking at the constellation of findings that could or did point to drowning or did not, let's talk about a couple of basic concepts. One I'm sure you all have heard of is the chain of custody. That's very different from the chain of command. As we all know, when we go to work, chain of command, you're an employee, let's say, and then you have your manager, a supervisor, in my case, a chief medical officer, a CEO, director of operations, etc. So there's sort of what I call the food chain in terms of the chain of command. And that likewise goes for law enforcement or any other type of agency. Here we're talking about the chain of custody. So, for example, when, I'll give a small example, when we have to do a drug screen for investigative purposes, that patient will go to a specific lab where an individual double and triple checks their name, date of birth, etc. And that individual either has to go into the restroom and observe the person urinating or voiding, or the person has to go to a specific restroom where the toilet water is of a certain color so that it can't be, you can't sort of cheat and come up with a negative drug screen, etc. Let's say the person has been observed. They have urinated into a cup. They give that urine cup to the nurse or the technician, and then, for example, in the emergency room, that technician signs, and then it has to go to the police officer, and then they sign, and it follows what we call a chain of custody, so that we know that from the moment that identified individual has voided or urinated, they have followed that specimen through a very safe chain of custody to the point where it arrives in the lab and it is tested, and then we can be certain that the results are indeed from that individual. So the chain of custody is extremely important. From one of the articles, scholarly articles, that I really find almost as a touch point, I want to make a quote, and I'm actually going to read it right now from something I wrote from this article, and that is, quote, "A submerged vehicle containing a body or bodies should be transported in its entirety to the medical examiner's office for in situ exam of the body and the vehicle to provide clues." Okay, so I'm throwing out concepts and ideas to you all, and I'm going to have you all go back to look at the documentation. But the question would be, I'm just going to ask the question, I'm sure you all know the answer, was Kiely's body removed from the vehicle and taken alone to the ME's office, or was the vehicle removed in the position that it was found? So in other words, it was found on its sort of on its roof. Was it removed from the water like that, not flipped, so as not to juggle the body or the location of the body or any evidence that might have spilled out, but that it was appropriately removed, not flipped, and taken to the medical examiner's office en masse, we say. E-N, mass, M-A-S-S-E, together. And that is important, because if there was, for instance, any form of tethering of a body, or even a seatbelt that may have inadvertently or purposefully been placed over, in this case, Kiely, and pulled out of the tailgate, and then the tailgate shut to hold her in place, we need to know that. And so hopefully photographs were taken very carefully of her position, anything inside, by law enforcement prior to them ever even moving the car. And then hopefully not moving the car from its found position, protecting all windows if they were broken out, etc., in order to prevent any loss of evidence, etc. And then once the car has come out, to move, before opening a tailgate, etc., to move en masse the body with the car. And then for the investigators to be able to, again, chain of custody, step by step, with excellent documentation and communication, note how prior to opening the tailgate, prior to moving the car out of its found position, how was the body found? This is very important. And I will say no more on that. Now, there is another statement that I just found very compelling in one of these articles that I read, and I think it's something that no matter what sort of place we are in life, whether we work in law enforcement, medicine, a restaurant, you're a teacher, you're a homemaker, basically this statement said in this article, and again I'll link this, that especially when looking at the potential for a drowning victim, it is paramount for in all agencies to coordinate one with the other, to communicate one with the other, because especially if concerned about a drowning versus a drowning suicide versus a homicide, and then somebody was dumped, so to speak, in a body of water, every single aspect of the case needs to be communicated in a very transparent fashion amongst agencies, so that when the autopsy report or any of the investigative documents are published, they are published in a very cogent, easy to read, but complete manner. So I wanted to bring that to the fore. Now, the final thing in this 10-minute that I want to talk about are twofold. One is, how do we identify a deceased body, okay, in general? And it is very different in a way when a body has been submerged for a length of time in water. And we're going to talk about the specifics of that in my next episode, which I think will come in a day or two. So the quintessential identifying method since the early 1900s is fingerprinting. And this was actually developed by the New York City Police Department. And soon thereafter, in the early 1900s, the Federal Bureau of Investigation of the FBI also embraced the concept that is your benchmark, that is best practices, fingerprinting. But obviously we know that unless you've been fingerprinted because you are required by your job, like for me, I'm fingerprinted throughout the years because of the type of work that I do, or if you've been arrested, if a person wants to adopt a child domestically or internationally, their fingerprints are required. So there are reasons that fingerprints are on record, right? But if a person like Kiely, let's say, was 16, never arrested, how can we know what her fingerprints are? So the ideal identifying method is fingerprinting. That aside, the next method is dental records. And I think dental records absolutely is a great method. We know that. And I'm going to give the example that in the Brian Laundrie case, fortunately, with great, we say in Spanish, anticipación, or with forethinking, the law enforcement knew that they were looking for maybe his body or him, but they went ahead and even before he was found, Brian Laundrie's dental records and dental x-rays were present. They had it in hand. So they could immediately use those, take x-rays of his, whatever was left of his mandible and his maxilla and the teeth, and do a comparison. And that is why they were so quickly able to turn around and so transparently say to the public, we had his records from his dentist, we've done a comparison, this is a definitely an identifier. And he has been clearly identified, or positively identified, as we say. Another method is DNA. So blood, hair, skin, and bone marrow. And actually a newer way in the past probably decade, is to actually get into the dentum of the teeth. So in other words, below your enamel, you have the dentum, and they can get and extract DNA from there. So that if there isn't a lot of anything left, other than, let's say, skeletal remains or your teeth, there's still a way to obtain DNA, and it has to be mitochondrial DNA. And then they use that DNA, post-mortem, after death DNA, from the dentum, which is below the enamel of the teeth, from bone marrow, etc. And they have a comparison, hopefully, from the toothbrush and or hairbrush of the person in question. And by using pre-death or pre-mortem sample from somebody's toothbrush or hairbrush, they make a comparison, mitochondrial DNA comparison, with the DNA found in those areas of the body that we have discussed. I have gone well over the 15 minutes, and my mother would not be happy, but I will just finish up by saying that those positive identifying methods, i.e. DNA, well, first of all, as we know, the fingerprinting, the DNA, and the dental, not necessarily in that order, but those three are sort of the only ways that we can really positively identify a victim. There are presumptive ways, and those would include, if the body is not too decomposed, having the family identify, if they're willing and able, to identify the body. However, we know from history, and not too far away history in the past, that there have been misidentifications, even by parents of their child, their deceased child. They've misidentified, and it wasn't their child. So that using a family member to identify is considered presumptive, and it certainly is not a 100% guarantee. In addition, we can use presumptive identifiers like the age, race, sex, or some physical characteristics of the victim. Markers, we say. Markers like tattoos, markers like jewelry or piercings. So those can be used as presumptive identifiers. And finally, circumstantial identifiers. In the case of Kiely Rodni, she was missing. Her car was missing. The car was found. One body was found in the car. Okay, most likely that represents Kiely Rodni. And then you say, well, can you utilize any clothing that she was last wearing, jewelry, tattoos, etc.? All of that can be used to make a presumptive diagnosis. Not a definitive diagnosis, but a presumptive diagnosis. We'll talk more about that in part 3. How was diagnosis, or identification, I should say, of Kiely Rodni actually made? Were photographs taken from below water to the point where the car was taken from water, and obviously autopsy, during autopsy photographs? And how was that done, and was their chain of custody maintained? Thank you for listening to all of this. 15 minutes, I think, turned into 20. And for now, I'll just say adios, mis amigos. Adelante con valentía. Go forward with courage. And in Italian, we say avanti con coraggio.